Well, if you're missing one tooth, it's very straightforward. You would have one implant for one tooth. If you're missing two teeth and they're towards the front of the mouth, say for the very front teeth, then sometimes we can place one implant to support two teeth. So that's a bit more cost effective, works very well, mechanically very strong. And if you're missing 3 or 4 teeth, then again we would place 2 implants to support those 3 or 4, what we call a bridge. And if you were unfortunate enough to have all your teeth missing or to need all your teeth removed, then we would be able to restore the whole set of teeth just on 4 implants, a process we call teeth in a day. If that's simply not possible from a budget perspective, then we do have a last option, which is 2 implants in the lower jaw, and those 2 implants can help stabilize a denture. So you don't get rid of the denture, it's still a denture, but it's much more comfortable and much more fixed than it would be if you didn't have any implants to help support it.